Hey everyone, how's it going? Dr. Ty Hall here, coming at you from East Valley Chiropractic. Wanted to jump on today with our weekly video, and today what we're going to talk about is radiculopathy. That's the kind of more the scientific term for it, but many people know it as numbness and tingling either in the arms, the hands, and the fingers, or in the legs, down into the feet and into the toes, also known as sciatica down low there. So radiculopathy, again, like I said, what that is that's that numbness, that tingling, kind of that sharp, weird feeling and sensation that occurs in the arms, hands, and fingers down in the legs. And what that actually stems from is from irritation to the nerve roots, specifically in those areas that control that. Now, when we talk about the arms, hands, and fingers here, the nerve roots that we're talking about is C5, C6, C7, and T1. Those are the nerves that form what's called the brachial plexus. So those are the nerves that start here in the lower part of the neck. They travel down the arms, over the middle part of the back, down in the arms, hands, and fingers, give you control and sensation of this particular area. When we talk about the lower lumbar spine, sciatica, or that radiculopathy down in the lower legs, those are the nerve roots that we're looking there, are L3, L4, L5, and then the sacral segments S1, 2, and 3 as well. Those are the areas that we're looking there. And what can cause this is many different things. Most commonly, what I see that causes this is actually a loss of movement or motion within the joints in this area. So when that joint locks up or rust builds up, so to say, what happens is there's inflammation that will happen along that nerve root and causes irritation. So the hole that the nerve comes out here, so the nerves come right out of the spine, that hole that the nerves come out of, it gets inflamed, and so the hole will get narrowed and then compression upon the nerve root causing that numbness and tingling. Oftentimes, sometimes people will, when they have this numbness and tingling, they also will feel or notice maybe like a loss in muscle strength. Again, because those nerves, they not only control the function and the feeling of those areas, but they also control the motor function. The best way that we can determine that is obviously through X-ray. That'll help us determine which areas in the spine have stopped moving and really narrow in and stem where that's stemming from and how that issue is occurring. And then most importantly, what do we need to do to get it corrected? Sometimes you'll also see degeneration within the spine. So from past accidents or injuries, the spine can degenerate, the disc space will start to narrow and thin. So that's another area that we can see on X-ray through proper diagnostics of where that area is being affected and how it's affecting the symptomatology that you're experiencing. So if you know somebody who is experiencing with radiculopathy or that numbness and tingling, or maybe that's yourself, give us a call, 952-423-5050. We'll be able to sit down, figure out where the problem is at, and most importantly, what do we need to do to get that corrected so you're not experiencing that pain and you can get back to doing the things that you need to do. Thanks so much, guys. We'll talk to you soon.